Hi everyone, I'm Ali GREYMOND. We're answering questions about OCD recovery. So if I haven't covered your question in the previous video, I would probably most likely be covering it in this one or the next one. So first question is, whenever I stop one habit, another one starts. Old one I previously beat or a new one. Is this just going to keep happening or can I fix this? This happens a lot. The reason why it happens is even though you're working on one thing, you have to kind of look at it as the entire thing as well. Yes, you're working on beating one habit, but also look at it as a whole. So you're not kind of just diverting from one to another. You have to pay attention to the full picture as well. If you start to really focus on what you're doing in all the areas, as well as specifically working on the one, I think you're going to have a better result. Usually with clients, I do like to have a main focus, but also we do at least try to do something in other areas. And really, like when I'm talking to people, I always try to ask them, are you doing anything else? Is there something new going on that you haven't been doing before? Because we want to make sure that you aren't doing anything new to create more OCD. So I would just be very focused on it. But yeah, if you're focused, it's not going to be an issue. It's just because you're kind of going from one to another still. Hi, Ali. I've been struggling with harm existential OCD for about 2 months, but now the thoughts have stopped considerably. I feel a bit emotionally numb. What does this mean? I think it's just, you just had a hard time with dealing with it, so the numbness will go away. Try not to focus on it and really try to do more exposures for the OCD thoughts that you've had before. If you feel like you're getting obsessed with how you feel and have extreme worry about being numb, then use that thought as exposure. So what if, why do I feel numb? What do I feel, all that stuff? That's the exposure. And then prevent the response of fear to it. So no, I'm not answering. I'm not dealing with it. If that's how you feel. If you just are kind of worried about it, but it's not obsessive, then do exposures for your original harm or existential OCD. Next question is, my worry is whether something happened or not. So this is a what if thought, right? So this is false memory. I tried the tips in the video about saying, okay, this is just an OCD thought. How do I know it's not something I just forgot and didn't happen? So, okay, with this, I can, you won't be able to reassure your way out of OCD. So let's just make it clear that the more reassurance you seek, the worse you're going to get. You're not going to get better by trying to figure things out, because it's just going to throw a new loophole or a new what if or maybe a slightly different situation, and it will just get you right back into it, solving another thing. So you're just going to go from solving to solving to solving. You don't want to do that. What you want to do is just say, yeah, forget it. Same thing. It's false memory. It's classic false memory. And I'm choosing to step over the fear and keep going, even though I feel uncomfortable. So you're making the choice to push forward, even though you can't get 100% reassurance. From my perspective, I hear this every day. So it's, this is classic OCD and you have nothing to worry about. But you can't continue to reassure yourself of this over and over again, Next question is, how do you recover from OCD when the OCD is focused on recovery? So this is what kind of what we were talking about in the question about feeling numb. I am so confused as to when I'm supposed to move on from my impromptu exposures and always worry that if I'm in an OCD episode when I'm probably not, and the OCD is actually now focused on recovery. This is so hard to push through. So I would say that you are already pushing. You are already doing the right thing. So whenever you get a thought, am I recovering correctly? Am I doing the right thing? Always treat it as an OCD thought. So any worry about OCD recovery for you right now is an OCD thought. Don't allow yourself to think about it. You're just doing what you were always doing. You're pushing through, you're disregarding, you're doing exposures, and that's all you need to do to recover. You don't need to analyze recovery. You just need to do the work. The more you analyze from a position of fear, the worse that's going to get. So you're choosing not to do that. Next question is, hello Ali, because of my contamination OCD, I find buying food really difficult as the packaging will often have marks on it and I worry it may be contaminated with blood. Because I throw so much away, I'm losing weight and a lot of money. Any advice would be appreciated. Thanks. You have to stop doing that. Start with something small that doesn't scare you as much, and every day refuse to do what OCD tells you. Every time you get an opportunity, no, I'm not going to throw it out. Yes, it makes me extremely uncomfortable, but I'm just not going to do it anymore. And really try to get... to be honest with you, in this situation, I would suggest doing the recovery program. Just because it might be too hard to do it on your own. And my doors all, I am now booking ahead because I am so I'm fully booked right now in this moment, so I'm booking for a few weeks ahead, so I can't see you the same day, but maybe we can have at least a session and then start as soon as I possibly can, because I just try to push as much as you can on not throwing things out. But, with this, it might be a little bit difficult to do on your own. Hi, Ali. Thank you for sharing your brilliant advice. Thank you for leaving nice comments, guys. The trouble I get is when I don't react with fear to a thought, my mind throws an even scarier thought. So because you're not reacting, so your mind's like, no, you have to get back into reacting. What is the scariest possibly thing I can think of? And it just throws it at you. And if I ignore the thought, it throws even scarier thoughts to lock me into fear until I give in. I avoided reacting to the thoughts for a day, noticed I was getting less thoughts. Is there a way to stop your mind from throwing scarier thoughts at you, or do you just have to battle it out? You just have to battle it out. It's going to do this. It's not going to be forever. You just have to be... I find when you're prepared for it, especially if you're in a situation that you're very likely to get OCD, it really helps, because then you can say, okay, you know what? Right now, I am very likely to get OCD. If I do, I'll know how to react, and you prepare yourself for getting that hit of anxiety, right? And then when it does come, you're ready, and you can, even though it's still difficult, it's a little bit easier, Hi, Ali, can you explain what real event OCD is? Real event OCD is an OCD that stems from a real event. Different people explain it differently. Based on my experience, almost every OCD comes from a real event OCD. For example, it could be a traumatic event or it could be a nothing event, but it's not what OCD makes it out to be. So I'll show you both examples. So in example one, say in a traumatic example, a person experiences a death of a loved one, and after that the person gets some sort of a harm OCD thought. Either has to do with false memory or just harm thought OCD, the harm OCD in general. What if I don't know, kill somebody in the future, or what if I killed somebody in the past, those kinds of things. And the stress of losing a loved one, pushed them into OCD. Sometimes it can be from real event OCD, but a nothing real event, which is, say I was driving, I hit a curve or like a speed bump, and I thought it was a person. So technically, yes, the person was driving. Technically, they did hit something, but it was just a speed bump, right? But they think, but that what if? So there's a few different variations, but OCD always creates something else out of it. So, even though it stems from something, that something has nothing to do with the actual situation, and it's actually not dangerous at all, but the person will twist it into something completely different. Not the person, but their OCD. I've been trying to do the work for 5 days now, but I'm finding it difficult to not automatically react to my thoughts surrounding the false memory. Though my false memory is more of a what if with a handful of mental images attached. So mental images attached are common. In terms of automatically reacting, you can't control something that's happening on autopilot. So as soon as you realize you're reacting, that's when you can control it. Before that, You reacted on autopilot, you reacted on autopilot. When you understand that you reacted, stop reacting. Stop checking, analyzing, researching, whatever, you know? I felt I was doing better for the first few days of doing the work, but I feel I had a major setback today when I got a really scary what if about my false memory. How do I stop myself from automatically reacting or feeling scared? You can't really, as soon as you realize that's when you stop. And so you're choosing to stop even though you feel fear. Also, how long do you think it'll take before I start to believe or feel that I didn't do what my false memory say I did? So it's different for everybody. It kind of lifts where in the beginning it feels so real, but as you go and you know the feelings of fear start to kind of lift, you start to see it. Oh, that doesn't even make sense. That's not right. You know, and you kind of start to see more and more through it, and it becomes less intense. So the length of time really depends on how much you power through. If you take one step forward and then immediately take one step back, then you're not really going anywhere, and it's going to take a long time for your brain to get that there's no danger attached to it. But if you really power through and really disregard, then it can be pretty fast, you know. I would say maybe a few weeks, you know. So it really depends on you. You know, you really have to put 100% into it, even though it's scary, even though it feels real. Doesn't matter, you keep going. That's the end of the questions for this video. I will answer the rest in the next video. Thank you so much for watching. Subscribe. I'll see you